Peripheral vascular disease, often referred to as PVD, is a condition that many people may not fully understand, but it's crucial, especially in the context of nursing and healthcare. At its core, it is a circulation disorder, specifically affecting the blood vessels located outside of the heart and brain. It's a widespread issue that can have significant implications for overall health. This primarily manifests mainly in the arms and legs, where these vessels play a vital role in delivering oxygen and nutrients. When these vessels narrow due to plaque buildup or get blocked altogether, the blood flow to the extremities drops significantly, subsequently causing pain, the development of slow-healing wounds, or in severe cases, even tissue death, also known as necrosis. Nurses play a key role in managing PVD, carefully checking pulses in the extremities, thoroughly assessing skin for any signs of ischemia, and diligently catching early signs and symptoms of the disease. Spotting the difference between arterial and venous issues is crucial for proper treatment and management, like knowing when to elevate legs to promote venous return or avoiding elevation in arterial insufficiency. Early recognition and intervention are key, as it prevents complications such as stubborn infections and, in the most severe cases, amputations. When preparing for the NCLEX, it's important to focus on practical assessment techniques, appropriate interventions, and comprehensive patient education strategies. Be sure to think critically about risk factors associated with PVD, the various symptoms that patients may present with, and the necessary emergency actions to take in critical situations. This guide will break down the underlying causes of PVD, the diverse range of symptoms, and the tailored care strategies required for managing conditions affecting both arteries and veins. By the end of this module, you'll be well equipped and ready to confidently tackle any PVD-related question on the NCLEX. So let's dive in and get started. The primary cause of peripheral vascular disease, or PVD, is atherosclerosis. This condition develops gradually over time, often without noticeable symptoms in its early stages. Atherosclerosis involves the buildup of plaque within the arteries, a process that narrows these vital pathways and restricts blood flow to the limbs and organs. This reduction in blood supply can lead to a variety of complications. Blood clots, such as those associated with deep vein thrombosis, DVT, can also abruptly block blood vessels, leading to sudden and severe reductions in blood flow. These situations are considered medical emergencies, requiring immediate intervention to prevent serious consequences. Other potential causes include vasculitis, which is inflammation of the blood vessels, physical injury to the vessels, or infection that damages the vessel walls. Major risk factors: smoking, diabetes, high blood pressure, high cholesterol, obesity, and physical inactivity. Advancing age and a family history of vascular disease also significantly increase an individual's risk. Smoking and diabetes are particularly damaging to blood vessels, accelerating the development of PVD and increasing the likelihood of severe complications. Therefore, nurses must be vigilant in assessing patients for these risk factors. This includes asking detailed questions about their lifestyle, family medical history, and any pre-existing health conditions that could contribute to PVD. Recognizing and identifying high-risk patients is crucial for implementing early intervention strategies and preventive measures. It's also essential to always be alert for any signs or symptoms of PVD, especially in individuals with multiple risk factors. Patient education and preventive strategies are key components of comprehensive nursing care for individuals at risk of or affected by PVD. A thorough understanding of your patient's individual risk profile is essential to guide your assessment and tailor an effective care plan. Diagnosing PVD starts with a focused history and physical exam. Ask about leg pain with walking, intermittent claudication, numbness, tingling, or coldness. Inspect legs for pale, shiny skin, hair loss, and slow healing sores. Check pulses in the feet. Weak or absent pulses signal arterial problems. Assess temperature and look for ulcers. The ankle brachial index, ABI, compares ankle and arm blood pressures. A low ABI means arterial disease. Doppler ultrasound and angiograms help locate blockages. Blood tests check for cholesterol, blood sugar, and clotting issues. Nurses often assist with these tests and interpret results. Early detection leads to better outcomes. Peripheral arterial disease, often referred to as PAD, is the most common arterial disorder affecting a significant portion of the population. It's crucial to understand this condition to provide effective care. PAD is characterized by reduced blood flow to the legs, which can lead to a variety of complications if left unaddressed. This reduced flow deprives the muscles and tissues of essential oxygen and nutrients. A classic symptom of PAD is intermittent claudication. This presents as cramping leg pain that occurs with activity such as walking or climbing stairs and is typically relieved by rest within a few minutes. As PAD worsens and becomes more severe, pain can occur even at rest, particularly at night when lying down. To help remember the key signs and symptoms, use the ARTS mnemonic. A stands for absent pulses or loss of hair on the legs and feet. R represents round, red sores, often found on the toes or feet. T indicates toes or feet that are pale or even black, suggesting severe ischemia. And S stands for sharp calf pain, especially during exercise. Acute arterial occlusion is a sudden blockage of an artery, often due to a blood clot. When assessing for acute arterial occlusion, watch for the 6 P's pain, often severe and sudden, pallor or a pale appearance of the affected limb, pulselessness, the absence of a palpable pulse in the affected limb, paresthesia or a tingling or numb sensation, paralysis or the inability to move the affected limb, and poikilothermia or coolness of the affected limb. Recognizing these 6 P's is critical because this condition is a limb-threatening emergency requiring immediate intervention. It's important to note that Raynaud's disease is different from PAD and acute arterial occlusion. Raynaud's involves vasospasm in the small arteries of the fingers and toes, typically triggered by exposure to cold temperatures or emotional stress. This vasospasm causes characteristic color changes in the fingers, progressing from white to blue to red, and is often accompanied by numbness and tingling. Key aspects of patient education for Raynaud's include advising them to avoid cold exposure and manage stress effectively. Recognizing these distinct patterns of vascular disease is vital for prompt and appropriate care, leading to better patient outcomes. Remember, quick action and timely intervention can often save limbs and improve the quality of life for individuals affected by these conditions. Venous disorders involve blood pooling in the legs due to faulty valves. Chronic venous insufficiency (CVI) causes swelling, aching, and skin changes. Use the Veni mnemonic: voluptuous pulses, edema, irregular sores, no sharp pain, dull ache, yellow-brown ankles. Deep vein thrombosis (DVT) is a clot in a deep leg vein. Look for swelling, pain, redness, and warmth, usually in one leg. DVT can lead to life-threatening pulmonary embolism. Varicose veins are twisted, bulging veins from valve failure, often cosmetic but can cause discomfort and ulcers. Prevention and early detection are nursing priorities. Teach patients about symptoms and when to seek help. Proper care reduces complications. Nursing care for PVD focuses on improving blood flow and preventing complications. For PAD, encourage walking, avoid cold and dangle legs, never elevate. For CVI, elevate legs, use compression stockings, and promote calf exercises. Teach patients to avoid prolonged standing or sitting. Medications, antiplatelets and statins for PAD, anticoagulants for DVT. Nurses administer meds and educate on side effects and safety. Severe cases may need angioplasty, stents, or surgery. Provide pre- and post-op care and reinforce lifestyle changes. Quit smoking, healthy diet, manage diabetes and blood pressure. Patient education is critical for long-term success. Empower patients to take charge of their vascular health.